This is one of the most, if not the most commonly asked question I get. So today I'm doing an updated, simple explanation on the difference between Medicare supplement plans and Medicare Advantage plans. So stay tuned. Hi everyone, I'm Stephanie Apt. I'm a licensed Medicare insurance broker, and welcome to my channel. This is where I answer my most commonly asked Medicare questions and offer educational Medicare videos so that we can hopefully help you simplify the confusing world of Medicare. My team and I are licensed in almost every state, so we help seniors all over the country with their Medicare insurance. And one of the most common confusions I see is people not always understanding the difference between Medicare supplement plans and Medicare Advantage plans. There are also lots of advertisements that you'll see on TV that make this even more confusing to people. And there are a few videos out there that talk a little bit about the difference between these two options. But today I really wanted to do an updated video about this topic, so that's what we'll dive into. Traditional Medicare has two main parts to it, Medicare Part A and Medicare Part B. Part A is your hospital insurance, and for most people that's free. Medicare Part B is your medical insurance, and for most people you have to pay for that. The standard premium for Part B in 2021 is $148.50 per month. It may be higher if you're a high income earner. And that Part B premium can increase over time. And once you enroll in Medicare Parts A and B, you essentially have two main options on how to receive your Medicare benefits. It's kind of like there's a fork in the road. You choose one path or the other, and that's how you'll receive your coverage. So I'd like to use a little flow chart to explain this. And it's important to know that no matter which path you choose, you generally still have to pay your Medicare Part B premium, that $148.50 per month premium. You still have to pay it no matter which path you choose. The first path is where you keep traditional Medicare Parts A and B as your primary insurance coverage. And this means that you can maintain the freedom to visit any Medicare doctor anywhere in the country, and most any medically necessary service is going to be covered by Parts A and B. Your doctor, your hospital will bill Medicare as your primary insurance. And from here, you'll likely add on a standalone Medicare Part D prescription drug plan to cover your prescription medications. Additionally, many people like to add on a Medicare supplement or a Medigap plan to cover all of the deductibles and co-insurance and out-of-pocket costs that traditional Medicare Part A and B doesn't pay. Medicare supplement plans are offered by many different insurance companies, but the benefits are standardized. So if you pick, let's say, a Medicare supplement Plan G with one company, that's the same exact plan as if you were to purchase it through any other company. So what's good about Medicare supplement plans? What's good about this path? First off, there are no doctor networks that you have to worry about. So you can always visit any Medicare provider wherever you are, wherever you live, wherever you travel. You can choose your own doctors. Secondly, on this path, you have peace of mind in knowing that you won't really be hit with any huge medical bills, right? Because your Medicare supplement plan is going to cover almost all of your potential out-of-pocket costs under Parts A and B. These plans give you very comprehensive coverage, so usually you have little to no deductibles and copays. So what is the downside to this path? Well, Medicare supplement plans do have an additional monthly premium that you have to pay on top of the Part B premium that you're already paying. In most parts of the country, Medicare supplement insurance for a 65-year-old will range from $80 a month to $150 a month, but that depends on where you live. Additionally, these plans don't include dental and vision benefits. So Medicare supplement plans are designed to cover all of the services that traditional Medicare Parts A and B covers. And since traditional Medicare Parts A and B doesn't usually cover dental and vision services, then your Medicare supplement plan typically would not either. Now let's talk about the other option, the other path you can take, which is Medicare Advantage. Medicare Advantage plans are also known as Part C of Medicare, but really these are plans that are alternatives to your traditional Medicare benefits. So private insurance companies contract with Medicare to offer these managed care Medicare Advantage plans. And Medicare Advantage plans cover all of the services covered by traditional Medicare Parts A and B, and they usually include your Part D prescription drug benefits rolled right into the plan. When you enroll in a Medicare Advantage plan, like an HMO or a PPO plan, you are choosing to receive your benefits through this insurance company's managed care plan. So when you go to the doctor or the hospital, they don't bill traditional Medicare any longer. They bill your Medicare Advantage plan insurance company. Medicare Advantage plans can establish their own cost shares, their own copays, their own deductibles for your medical and hospital services. Additionally, these plans often include some coverage for things that are not covered under traditional Medicare, things like dental or vision or hearing services. Keep in mind, like I said before, in most cases you must continue to pay your Part B premium even if you enroll in a Medicare Advantage plan. So what's good about Medicare Advantage plans? Well, these plans are usually very affordable. In most parts of the country, Medicare Advantage plans start at $0 a month. So they can be a really great alternative for people that can't afford a Medicare supplement plan. Also, these plans roll your medical, your prescription drug coverage, and sometimes your dental and vision coverage all into one plan. So you have one card that you're carrying around in your wallet, and a lot of people like that convenience. So what are the downsides to these plans? Well, these plans do use provider networks, which can change over time. So you don't have as much provider freedom. Typically, you're more limited to a set network of doctors and hospitals. Some plans do offer coverage out of the network, but it's usually at a much higher cost share to you. Also, Medicare Advantage plans have out-of-pocket maximums that are put in place to help cap your out-of-pocket spending in the case of a catastrophic medical event. But many Medicare Advantage plans do have out-of-pocket maximum limits that are on the higher end. In 2021, the standard out-of-pocket maximum limit on Medicare Advantage is $7,550 per year. So if you had a major medical event, illness, etc., you may be responsible for up to that out-of-pocket limit each calendar year. Additionally, these plans may require referrals to see a specialist or prior authorizations for certain medical services, whereas traditional Medicare has historically rarely required prior authorizations for medical services. So there are many different factors to consider when you are debating Medicare supplement plans versus Medicare Advantage plans. Your budget, your medical history, as well as what types of plans and pricing are available in your area are just a few of the things that you'll want to take into account. And of course, this is exactly what we help people do every day. As an independent broker, our service is free of charge, and because we work with both Medicare Advantage plans and Medicare supplement plans, we are able to offer you an unbiased review of the plans in your area to help you determine which type of coverage will best meet your needs. Something that's important to remember is that in most states, Medicare supplement plans are typically medically underwritten when you are not new to Medicare. So in other words, when you're new to Medicare, you have this one-time open enrollment window in which you can purchase any Medicare supplement plan you'd like without any medical underwriting, and you're given the preferred rate. But after that window closes, you will typically have to pass through medical underwriting to even qualify for a Medicare supplement plan in the future. Medicare Advantage plans, on the other hand, are not medically underwritten, and typically any Medicare beneficiary can enroll in a Medicare Advantage plan every fall during the annual election period. So a lot of people assume that they can just flip-flop or switch back and forth from Medicare Advantage to Medicare supplements from year to year, but that is not necessarily the case. It will depend on your health if you want to go from a Medicare Advantage plan to a Medicare supplement plan in most situations. An easy way to find out about your eligibility for plans and pricing in your area is to go ahead and give us a call. You can shoot me an email and my team and I would be more than happy to assist. Thank you so much for watching. If you found value in this video, I'm going to ask you to please click the like button. You can subscribe to the channel if you haven't done that yet, and definitely leave all of your questions and comments for me down below. Thank you again so much for being here, and we'll see you soon.